Gauteng being the epicentre of the third wave of COVID-19, a hard lockdown isn't an option, as we were hearing. The Gauteng Premier says the economy simply can't take it. Now, the province has been recording between 8,000 and 10,000 new infections per week. For more analysis on this, Professor Francois Venter from Ezintsha joins me now for more. Francois, a very good evening to you. Was that the right call not to go down into a harder lockdown, that we're going to get a mix of 3 and 4?
It's way too late. It's difficult to convey how much trouble Gauteng is in at the moment. Our death rate went past the first and second wave yesterday, and our health system is crumbling. It's buckling at the seams, and the new number of cases is still screaming up. So we're only going to see the worst of this epidemic in 3 or 4 weeks' time. So July is going to be a catastrophe for Gauteng. We are in terribly dire straits. The time for lockdowns and those discussions passed weeks ago, I'm afraid. It has to be about preserving the health system at this point.
Do you think, and I mean, I know it's hard to say in retrospect, but do you think it would have helped if we'd gone into a harder lockdown sooner?
Not really. My personal view is that we should have been focusing since March last year on just educating people about the dangers of indoor meetings, not opening the windows and all those things. Hard lockdowns have a huge amount of destructive capacity, but at the same time, I have very limited capacity in terms of protecting the healthcare system. So these debates about curfews and alcohol and all the rest of them are a little bit of a distraction to my mind. The level of rise in infections in Gauteng is unprecedented. The numbers in Joburg at the moment are higher than any time we've seen at any point in the epidemic in South Africa. I'm not convinced that hard lockdowns would have made much of an impression. It's very important, though, that human behavior does stop the transmission. You can protect yourself. But what's going on here is a level of infection we've never seen before.
And I'm sure it wouldn't have been so bad if we'd got the vaccines out and if we had more medical services for South Africans. I mean, what is your response now that Charlotte Maxeke is going to partially reopen?
No, I think lots of hard questions need to be asked. Is why are we, well into the third wave, running around trying to find staff, and why... I was listening to the Gauteng Command Council presentation today, and they were proudly telling us how the level of increase was exactly what they predicted for their worst case scenario. So they actually did predict this. Why are they not ready then for this? Is why did there have to be so much advocacy to actually get Charlotte reopened? It was only because of mass academic and activists coming out and saying, why haven't you done this, that this actually materialized. And your question about vaccines also needs to be asked, and this is not specific to Gauteng, it's for the whole country, is why are we going so slowly? Why are we entering the third wave essentially unvaccinated, except for a few lucky healthcare practitioners and a tiny percentage of the elderly who were only just vaccinated just in time, most of whom are probably not even protected for this third wave?
I was speaking to Ruda Mativa a little bit earlier on. I don't know if you heard what she said. I mean, she was quite emotional about the lack of medical staff and how difficult it is to get the talent that we've managed to keep in this country out there working today. I mean, that's a massive problem, not just for today, but years ahead.
And she's a proper frontliner. She's sitting at Barrow, at the epicenter of all of this. So people need to listen to what she has to say. And I think this is the thing, is the Department of Health says, we're going to just manufacture some healthcare workers. It's not like South Africa's sitting here with healthcare workers to spare. These are, to run an ICU or to even run high-level cares of nursing takes months and years of training. So, to suddenly say, now we've all these lovely new facilities we built a year ago and we forgot to staff them. Where are these staff going to come? We've already heard problems with the South African Defence Force staff being deployed in the Eastern Cape. This is not a quick fix. So there are really hard questions to be asked about Gauteng's preparation in terms of this third wave.
And you look at what you look...
Is that even if it's bad, if it was even as bad as the second wave or the first wave, we would have been overrun. But this is really out of control.
I mean, I was talking to, we went over to the Western Cape a little bit earlier on, and they seem to, well, what they say anyway, they've got it in place. They've got an action plan in place. They've got the field hospitals ready to take over the overflow of people. I mean, now we hear the Gauteng Premier saying that finally we're going to open up some of the Nasrecs and those that have been sitting there in their billions empty. I mean, why is that? Why has that not happened?
It's completely inexplicable to me. Yeah, we spent so much money on building these facilities and outfitting them. Why are they not ready to go? You know, granted, this surge has been severe, but it was pretty predictable that it was going to come in June. You know, they were told, both by the sounds of it, I was reading reports about the Ministerial Advisory Committee, told them it was coming, that there was a good chance it would be hitting us in June. Why are we only waking up when we're seeing record numbers? And I think that these are the hard questions that need to be asked of our healthcare services. And a lot of people are going to die because of a lack of capacity, which was foreseeable and we could have been planning around.
And we're seeing a couple of disturbing developments. I mean, the amount of times that people have to make a choice of who's going to be looked after, who's going to be saved, and the fact that we're seeing a lot more younger patients too.
Yes, I think that, you know, we have to clean up the mess in terms of what's going on now, but counting who died and, you know, and why they died, how much of that was reversible, how much of it was preventable, is going to be a tragic audit we're going to need to do at the end of this third wave. I think what worries me is that at the rate we're going, we're not even going to have enough people vaccinated to protect us from the fourth wave. You know, there's a pretty good chance that we're going to be facing this in December. So we really do need to do better with the vaccinations. I was listening again to the Command Council and said they've vaccinated 28% of old people. You know, that's only partially vaccinated them. We really have to go faster and be more ambitious and must stop making excuses about vaccine hesitancy. 28% is not vaccine hesitancy. It's program inefficiency and poor delivery. You know, when you get to 80%, you get to talk about vaccine hesitancy. So we really do need to get cracking with and take this more seriously.
Agreed. Francois Venter, thank you.